Let's talk about a substance that, might be sitting in a supplement bottle in your cabinet right now. We all know it's for building strong bones, but what if I told you that in the back of an ambulance, it has this secret identity as a drug that can literally stop a heart from failing? This is the incredible story of calcium gluconate.
Right, so when you hear the word calcium, this is what pops into your head. Milk, cheese, and yeah, strong bones and teeth. It's the mineral we're all told to get more of since we were kids, and for good reason.
But what if we took that same element, put it in a very specific form, and suddenly it's one of the most critical emergency drugs we have? I'm talking about a substance that can quite literally pull a heart back from the brink of total disaster. So first up, let's look at its familiar side. What is calcium gluconate's day job anyway? At its core, it's just a salt. It's a stable, easy-to-deliver form of calcium that our bodies can actually use. Doctors prescribe it as a supplement for everything from osteoporosis to other conditions where the body just can't keep its calcium levels up. Pretty simple, right? Straightforward and absolutely essential. But here's a crucial detail. Not all calcium drugs are created equal. Calcium gluconate is only about 9% pure, or what we call elemental calcium. Now compare that to its close cousin, calcium chloride, which packs a much bigger punch at 27%. In a hospital setting, that difference is everything. Giving the wrong one could cause huge problems, which is why the less concentrated gluconate is often the safer bet for a standard IV line. Okay, and this is where our story takes a really dramatic turn. Let's pull back the curtain on its secret identity, the emergency lifesaver. In an ER, this is no longer just a supplement. It's an antidote. It's used to treat dangerously low calcium levels that can trigger seizures, it can reverse overdoses of certain heart medications, and it even counteracts magnesium poisoning. But its most heroic role, by far, is in the fight against life-threateningly high potassium. Now, you gotta wrap your head around this, because it's a wild concept. When potassium levels in the blood shoot way up, the heart's electrical system goes haywire. It can cause a fatal, irregular heartbeat. Calcium gluconate comes in and it doesn't even touch the potassium levels. Nope. Instead, it acts like a bodyguard for the heart's muscle cells, basically shielding them from potassium's toxic effects. What it does is create a temporary bridge to safety, and the effect is incredibly fast. You can literally watch dangerous patterns on a heart monitor start to normalize in just a few minutes. Now, this protection only lasts for about an hour, so it isn't a cure, but it is a priceless hour of life that gives doctors the time they desperately need to start the real treatments that will actually fix the underlying problem. So how on earth does it do this? How can one simple mineral shield the entire heart? Let's dive into the science of stability. The key phrase here is membrane stabilization. Okay, so think of a heart cell's wall, its membrane, like a security gate. When potassium is too high, it makes that gate really twitchy and unstable, causing it to fire off electrical signals all wrong. Calcium comes in and basically strengthens the lock on that gate. It resets the normal electrical threshold, making the cell way less likely to fire when it's not supposed to. So it's this really elegant four-step process. First, the heart cells are destabilized by potassium. Second, a dose of calcium is given. Third, that calcium rushes in and shields the cell membranes. And fourth, just like that, the heart's rhythm can snap back to normal. It's just pharmacology at its most powerful. But listen, a drug this powerful has to be handled with extreme care. This is not something you just casually push into someone's system. In an emergency, it has to go directly into a vein through an IV. Orally, it's just that simple supplement we talked about. But, and this is a huge but, you never inject this into a muscle or under the skin. It is so caustic that it can cause what's called necrosis. It literally kills the tissue. So a drug that's a lifesaver in one place can be a tissue-destroying poison in another. And even when you're giving it the right way, through an IV, speed is absolutely critical. If you push this stuff in too fast, you can cause a whole new set of problems, from a sudden drop in blood pressure to the very same dangerous heart rhythms you were trying to stop. A standard dose needs to be given slowly, over 10 to 20 minutes. In this case, patience is literally a lifesaver. Okay, this brings us to the most serious part of our discussion, the critical risks. Because, as you can imagine, a drug this potent also comes with some major dangers. This right here is one of the most important warnings in all of emergency medicine. Digoxin is a very common heart medication. If you give IV calcium to a patient taking it, you can accidentally amplify that drug's effects and trigger a fatal reaction. It is a combination that every medic and doctor treats with extreme caution. And the list of warnings just keeps going. We've hit on the digoxin risk and injecting it too fast. If that IV line leaks out of the vein, it's a catastrophe for the surrounding tissue. You also can't mix it with a common antibiotic, ceftriaxone, because they can literally combine to form solid, deadly particles in the bloodstream. And of course, for patients with kidney problems, the dosage has to be absolutely perfect. It really is all about walking this incredible tightrope. Too little calcium in the body, and you get muscle spasms and seizures. Too much, and you could slip into a coma. The body needs that balance to be just right. Calcium gluconate is the tool we use to restore that balance, but it can just as easily tip the scales way too far in the other direction. So when you step back and look at it, you see this incredible dual identity. You've got the humble mineral supplement on the pharmacy shelf, and then you have the high-stakes emergency drug that can stabilize a dying heart. It's the perfect example of how the dose and the context can completely change what a substance is. It really makes you wonder, doesn't it? What other everyday compounds are out there, just quietly waiting for their moment to become a hero in a life-or-death situation? What other secrets are hiding on the pharmacy shelf, right there in plain sight?